Miraj Shah, who's Chief Operating Officer, Aga Khan University Hospital, Secondary Hospitals, Pakistan. For chairperson, I would like to invite Ms. Leslie Thompson, who's CEO, Accreditation Canada. Our co-chairman for the session is Dr. Rifa International University. For our panel discussions on hospital journey of patient safety, why, when, how, we have Dr. Lubna Mushtaq, Head of Quality and Monitoring Directorate at Indus Hospital and Health Network. Please, ma'am, if you could join us on stage. We have Dr. Abir, who's Assistant Medical Director, Taba Heart Institute. Professor Dr. Zahir Bashir, who is Chairman Al Khidmat Health Foundation. Mr. Hamad from Liaquat National Hospital, Karachi. Sir Asim, Dr. Asim Belgwami, Chief Medical Officer, Clinical Affairs at Aga Khan University. Dr. Haroon Hafiz, Director, Quality and Patient Safety Department, Shaukat Khanam Memorial Cancer Hospital. Mr. Shafiqur Rahman, CEO, Rahman Medical Institute. Dr. Muhammad Asad, Assistant Chief Clinical Officer, Islamic International Medical College, Pakistan Railway Hospital. Mr. Uzair, CEO, Mr. Uzair from Evercare Hospital. Over to you, Dr. Maraj.
Bismillahir Rahmanir Rahim. Assalamu alaikum. Good afternoon, everyone. Although it will be a challenging session and the last session after lunch, and we'll try to make you engaged. Please don't fall asleep, okay? So this is an interesting session, and as you see the theme of this panel discussion, it says hospital journey of patient safety. Why, when, and how? So there's a very famous Chinese proverb that a journey of 1,000 miles starts from a single step. And what a great experience it will be to learn from so many, learner speakers here. What was that first step which they took in their patient safety or quality journeys? So If we want to, we can go with a sequential order starting from uh, Professor Zahid Bashir, right? Zahid Bashir. All right. You have the mic there. Yes. Please introduce yourself and then start with this first step a little. You can throw light and then follow up questions will come and then we will catch up. We'll develop a momentum.
That's great. Bismillahir Rahmanir Rahim. My name is Mohammad Zahid Latif. I'm professor of public health, and currently I'm heading the Al Khidmat Health Foundation, one of the charity organization working here in Pakistan, not only in relief, rehab, but in the health sector as well. And Al Khidmat Health Foundation, Pakistan, across the country, I think it is among the largest organization with the physical presence in an extensive areas and widely geographical presence with more than 50 hospitals, starting from primary care centers to tertiary care hospitals as well. On one side from Chitral till Tharparkar, on the other side, Karachi and major cities as well. Similarly, we have 5+ mega diagnostic Pakistan with hundreds of collection centers, and we are providing services through these centers as well. A fleet of ambulances is available across Pakistan with more than 300 ambulances and around 2,500 beds capacity all over Pakistan, but it's not in one hospital. The largest hospital is of around 400 bedded, and the small hospitals, including 5-bed, 10-bed primary healthcare or secondary health, tertiary care. Our primary focus is related with maternal and child health care. However, we do have specialties, cardiology, nephrology, as per the requirement, and diagnostics as well. Talking about the quality and its relation and journey within Al Khidmat Health Foundation, primarily, I think that we are a value-based organization and a charity which is linked and associated with the principle and philosophy of Islam and the concept of patient safety. And if we go into the values of Islam, safety comes first. So as a Muslim, this is our responsibility to provide the services to the individuals coming to our hospitals, and the service must be safe enough, as is said in the Holy Quran, that he who saves a simple life is just like that he has saved the whole mankind. But if we just think in an other way around, if you are giving some harm to one patient in the same context, that means you are providing the harm to the whole mankind. So keeping this philosophy of Islam in our mind on one side, surely we are very much interested and working to provide access to healthcare, but at the same time, this healthcare access must be safe enough so that the result of our services should provide service in such a way that the individual must be benefit. Talking about the patient safety and quality improvement in a technical and professional way, we have initiated few years ago this whole process and project, and currently it is being led by Dr. Zakiuddin Ahmed, who is sitting here and is heading this organization, this 7th International Conference as well. We have inculcated a setup of capacity building, trainings. We are formally engaged with WHO and for training of our staff, our members, allied healthcare professionals. We are very much interested in registration, accreditation with the local bodies, healthcare commissions, and trying to complete all the legal requirements on one side. Similarly, we are trying to comply with all the standards of healthcare commissions in Pakistan. Surely it is related with quality. We have also developed some of our own standards, although these have not been published, and we call these standards as Islamic hospital standards. And we are interested that hopefully within next few years, inshallah, we will try to publish these standards so that all the centers of Al Khidmat Health Foundation will be Healthcare Commission Plus standards complied. On the other side, a system from the primary, because this is a very widespread network, we have developed a app which is based on these standards. And on a regular basis, we are trying to collect the data, reviewing it at the center, and complying with the requirement, gap analysis, finding some evidence, and trying to fill that gap in the light of that data available. Similarly, in another way, which is very important, we are one of the partner of this international conference as well. This is also our journey to comply and follow the concept of patient safety and quality improvement. Quality means, I was going through a definition, doing right thing, right time, right format, right for the first time, and for the every time. So I practically believe that this is an ongoing process, must be very much clarified, cleared at the beginning, timelines, goals, standards falling. But I think this is an evolving concept as well. So the concept which we are thinking about, especially in the context of West, I personally feel that in the context of Pakistan or the local context, must be considered before implementation. Context is quite different, quite different. Another said, Dr. Zafar Mirza was talking about tertiary care hospitals. And I assure you that implementing of these quality standards, especially in the primary care, that is much easier than those of implementing in the tertiary care hospital. So we are working for these implementation standards as well. And I wish we can link to the global partners, working organization, WHO, other these kind of academia, so that we can improve the quality and also take part in the development of these patient safety initiatives. One last thing, which is very important, I must mention here, that is related to research work. Data, its collection, we are working on it. Hopefully, this would be the largest database in Pakistan, from primary centers to tertiary care centers. We have also gone through mobile health units, and other initiative we will hopefully implement. With it's in the pilot phase, it's related to digital health. We are practicing it at the moment in Tharparkar and Shikarpur, linking these two centers virtually with the consultants across the globe, providing them the services, surely in the form of in a safe way, and but at the same time extending and trying to extend the accessibility of the services as well. So this is all from my side. Any question, if it is there, that's more welcome.
Thank you, Professor Zahid Latif. Very comprehensive response. Now, just to set a norm, I'll request rest of the speakers, try to understand the question. I mean, we are just beginning, we are opening a discussion with a question. I mean, I know that everybody's journey would be a very long journey. And the question here is, I think that my audience would be very much interested in knowing in this question, what made you to start your agenda on patient safety? Was there an incident? For example, was there a mortality? Was there a morbidity? How you got inspired? Was there an exciting speaker who came and who inspired you? Things like those. So was there from Evercare?
Bismillah ar-Rahman ar-Rahim. My name is Uzair Sheikh. I'm working as Director of Operations at Evercare Hospital Lahore, which is part of the Evercare group. We have our presence in Pakistan, Kenya, and Nigeria. So, Dr. Miraj, I've spent 12 years in AKU. I've seen what is the culture of safety, what is the culture of patient safety. So, since I left AKU, I went to another organization and I felt that the culture of safety is missing. Then I joined Evercare, and when we sit with our team and discuss what should be our first step, the first step was that we need to develop that culture of safety, because if the culture is not there, we can sit in our rooms and make all kind of strategies that we will achieve JCI in the next 6 to 8 months, but if the culture is not there, you will not achieve. So that was the building block of the reason that we started this journey. So how we did it, where we are, is a very detailed discussion. But if you can, I can answer this specifically. I think the culture of safety is one thing that was very important. Thank you.
Wow, wonderful. Janab. So that is a very, very specific response. Now, moving on to Liaquat National Hospital, Hamad, may I request you for the same response?
Assalamu alaikum, everyone. Moving to that question, there are certain incidents or there are certain near misses which we have observed in the year 2003 and 2002. Uh, After that, the management came with this idea that we need to establish a systematic approach and we need to adopt something which integrate all the processes. For example, OPD services to ward services for to OT services. So these all are the processes which need to be integrated. So they went for the certification, they got the management system, and still remember that in 2003, I was the external auditor who performed audit for Liaquat National Hospital laboratory services. So I get see Liaquat National Hospital with two different perspectives. One is as an auditor, and second, after 2015, I joined Liaquat National Hospital as a head of department for quality. So again, from both sides, I can see the evolvement and the continual improvement with respect to quality management system. So this is the journey which we are going through, and it goes on right now.
Wonderful. Thank you. Mr. Shafiqur Rahman from Peshawar, RMI.
Thank you very much for a very pertinent question. I'll briefly touch on the background and then I'll try to come to the answer itself. I think that the desire to have quality incorporated really starts minus day one. And in our case, the purpose of the hospital was to bring to KP, our province, a quality of healthcare that was not seen before. And that really went into the design of the physical infrastructure, which was back in 2002 and before that. So the thinking was there back then. And over the years, of course, you have milestones and triggers, which really highlights the importance of quality and patient safety. And in our case, I think that it was a few things that I'll just highlight. We started as a very small hospital, less than 50 beds. And you can manage things when you're at that scale a lot easier than when you scale up. We rapidly scaled up from 50 to 500 beds. And as you scale up, you appreciate even more the importance of systems and procedures and policies and that safety culture to be able to scale up, but do so in a safe manner. So I think that was one trigger. The other was our digitalization or automation efforts over the years. I think that brought to life or made things a lot more visible and actionable. Because once you've got these indicators that are visible there, it really highlights the urgency and the need for intervention So I think scaling up was one. The second was the automation bit. The regulatory requirements, of course, the PMDC and the Healthcare Commission also aided in this journey. And I think the next part that was quite important in our journey was we started as a healthcare provider, and then we went on to education, starting with the School of Nursing and then 4 other colleges with a little more than 2,000 students right now. When we went into that capacity building and training the healthcare workers is when we really realized the importance of prioritizing quality and patient safety, and for that to be practiced in the hospital where these students and graduates would then be practicing. So those were a few of the milestones in our case. Thank you.
Wonderful. That's our perspective. Okay, Asim Belgam.
If I may, can I show a couple of slides?
Oh, yes. Please go ahead. Yeah.
So I came with a couple of slides, so I'm going to show them. So the Khan University Hospital and the healthcare system now really comprises of a large academic medical center. It's about 750 beds. In addition to that, has 4 secondary level care centers, which Dr. Miraj runs, and a network across Pakistan of outpatient centers. We've got 19 of those, plus 300 lab collection centers and pharmacies, etc. So in that context, the scope really of quality care becomes fairly wide. And if I can get the next slide, please. Okay, so this is sort of our journey. The Khan University started in 1985, and really, University Hospital started in 1985, and really immediately the concept of having a structured quality sort of format was very, very important, and it was started right there and then. As we went on, we realized that there was need for external sort of validation, if nothing else, and so we went through the ISOs, and then finally in 2006 we became JCI accredited. In 2015, we became accredited as an academic medical center, so expanding the scope of the JCI involvement with us as well. In 2016, our main laboratory became CAP accredited, College of American Pathologists, and then on the other off-campus sites for labs also became CAP accredited beyond that. In 2019, we established the academic arm for quality within the medical college, which was the Center for Patient Safety, which is run by Dr. Asad Latif, who actually moderated the last session. And this then partners with the quality structure within the hospital in terms of education and research and quality standard setting, etc. In 2022, when Sindh Healthcare Commission started coming in for licensures, we were one of the earliest, actually probably the first academic medical center to be licensed. We are now, our pharmacy training, postgraduate training is accredited by the American Society for Hospital Pharmacists. And most recently, last year, the 4 secondary or secondary level off-campus hospitals have been accredited by SafeCare at level 5, at their top level. Next, please. But that doesn't stop. So we're going to continue on. We've got a whole plan for the next several years. By the end of this year, we're hopefully going to get, we hope, accredited by the AHSP for hospital and health service system pharmacy services. Next year, we're planning commission for accreditation of rehabilitation facilities by CARF. The year after that, on to Pathway of Excellence for our nursing services through the ANCC, and then on to patient-centered care certification from Plaintree. Next slide. So a couple of years ago, we actually went through a whole metamorphosis of our quality structure. And rather than imposing a centralized quality structure, which really we felt was more policing than anything else, ownership of quality and quality imperatives was really directed by the central body. And we felt that the ownership and uptake of quality initiatives really was not out in the front lines. So we flipped it. What we did was we created a system which really devolved the ownership and the responsibility of quality to the frontline sections. And we did it with 2 things. One is establishment of CUSPs. CUSPs is comprehensive unit-based safety programs. So every unit has a CUSP, and these units can be clinical units like in wards, or could be pharmacies or lab or other structures within the institution itself. And then the academic subspecialty sections, so a section of neurology and nephrology and neurosurgery, etc., were then also given the mandate for that. Their KPIs and what they looked at was slightly different. And if you can look at that particular diagram there, whereas the CUSPs look at things across transversally, looking at things which are more general care processes, making sure IPSGs are maintained, and looking at documentation and medication safety, etc., and nursing parameters. The sections looked at service-specific processes. For example, door-to-balloon time for cardiology or outcome of adult sepsis, etc. And these integrate. They work together in the 2 directions as they go through. Next slide, please. And I'm not even going to go through this. Why CUSPs? Because we felt that it was very integrative. It was team-based. It utilized all the members of the integrated team that was there and really brought the responsibility of quality care to the front line. Next slide. I think we can move on to this. I'm not going to, because of time, I'll go on to the next slide, please. All right. What did we do to prepare for it? Well, we realized that we can't just change a structure and throw it at the people and say, do it. So we started with training. The first training actually started very early in November 21, and Dr. Mehraj was the driver for that. And this was CPHQ training, certification for health quality, professionals in health quality training. There were over 100 people who participated in this. This was an online because this is during COVID. So this was an online training process. 80 something, 87, I think, finished that training in there. And so far, 14 of those trainees have already been certified as CPHQs. As we had decided that we would go with the CUSP model, we actually got together with Johns Hopkins, where the CUSP model actually originated, and had some master trainers trained through their program. So 6 people were trained through the Johns Hopkins master trainer course. These 6 people then trained 30 others. So we had a cohort of 36 people who were our CUSP implementers across. And this was across the board, included doctors, nurses, and other professionals. We started implementing the CUSP model phase-wise, and I'll show you a little bit of that. But as we were going through that, we continued to engage all our staff and everything. So we had CUSP town halls, for example. And then in order for them to have the tools, we continued on with workshops, hands-on workshop for different things. For example, quality improvement methodologies and tools, which Dr. Fawzia led, and other non-healthcare failure FMEA analysis on developing and monitoring CPGs, root cause analysis, and tracer methodology. So these are all hands-on training that we've done, and really divested the whole concept, the whole practice of quality maintenance to the front lines. And so now what happens is that our quality and patient safety team doesn't go and do a patient tracer, for example. Each unit runs a patient tracer every month, and the quality and patient safety team goes to validate it. And so the responsibility for ensuring quality has been divested out to the front lines. All right, next. This is how we went about implementing it. So started off small, so if we started with 5, trained them, set up the teams, got them running, learned from it, did the next 6, learned from it, did the next 14, learned from it, etc. And so these were actually implemented over a period of over a year, essentially. Next slide. What has happened with that? Well, here's some of the impact. If you can see, in 2021, we had 57 quality improvement projects that were active. This went up to 88 in 2022. And last year, we had 124 quality improvement projects that were run across the hospital in different units. Next slide, please. And what does that show? Well, the one on top, for example, is our sepsis bundle. One of the problems we were having was utilization of sepsis bundle. And so the medicine team in one of their medicine wards started off work on that. And you can see that the non-compliance, which is what this graph shows. Can I go back to that? Anyway, can I go back to the slide, please? So the non-compliance, the top graph shows the non-compliance. As the non-compliance decreased, so did sepsis mortality. We've learned subsequently that we've got to continue to be on top of things and continue to train new residents as they come in each year so that they do that. And after a little blip upwards, we've again managed to come back down again. The second one is a phlebitis quality improvement project that started again in one of the wards. This was nursing-led imperative. Started off there, and then they saw what one unit was doing, the second one did it, third one did it, fourth one did it. And so these are hospital-wide phlebitis rates. And as you can see, there's a significant drop in the phlebitis rates over time. And the last one is looking at our CPR, our code blue teams. So timeliness of attendance. We did multiple other things along with that, including debriefing and scoring, etc. And this has resulted in a increase in ROSC from 47% to 65%, and an increase in discharge to home, a 4-fold increase in discharge to home, actually. So what we believe is that giving the responsibility of quality care to the frontliners, training them for it, giving them the tools that they need to do with it, is really successful. And so that's really been our journey. Thank you.
Thank you, Dr. Hassan. You presented the entire journey. and covered all my remaining questions in one. But that's good. Dr. Harun, let's hear from you.
Yeah, thank you. To introduce myself, my name is Harun Hafiz, and I work as a consultant physician in palliative medicine and as director of quality assurance for the hospitals of Shaukat Khanum Trust. I feel slighted I didn't bring a presentation, Nazim, so I should have been given a forewarning on that. But nevertheless, our quality journey is not that dissimilar to Aga Khan, I'll be very honest. And one of the driving forces in us going on this journey was seeing that it can be done and done successfully in Pakistan. So I have no shame in saying that and accepting that. But at the same time, I have a lot of pride in saying that we have not only followed, but we have taken a few extra steps as well. We are the only hospital chain in Pakistan who are accredited. Each unit operated by us is accredited by Joint Commission. And we are the only site in the country to have enterprise accreditation. And when we got it, we were second in the world to get it. So then following on, we also have COPI certification for our chemotherapeutic services. Again, we are the only site in Pakistan, but then we are a specialist cancer center and it is geared towards cancer care. So that's why we went for it. ISO 9001, ISO 20000 for our food safety. These are some of the other certifications that we have gone for. But the trigger for us was obviously we are heavily reliant on the goodwill of Public of Pakistan to function. Over 50 to 60% of our budget is based on donations and zakat. And for that, we rely very heavily on goodwill of people. And there came a time when our donors started questioning us when people from AKU would tell about third-party certifications that where are your certifications? How do you show you are the only saying that you have got good quality care? How do you show you are actually doing that? And the safety journey was always there because obviously if people money is being taken, there's a religious component to the religious donations as well. So the safety component was always there because I believe quality and safety actually drives economy in healthcare. People think the reverse, but that's not true. It actually drives economy in healthcare. You make less mistakes. You have a happier workforce. So it's very important from that angle. And then obviously, once we went on those third-party certifications, we were able to show that, yes, we can do it and it can be done. So that's a brief trigger and journey of Shaukat Khanum into the world of quality.
Thank you so much, Dr. Harun. Very crisp description. Dr. Lubna, can we hear from you on Indus Networks? How did it started?
Okay, thank you so very much. Indus Hospital started with a sad story of late 90s. In 1980s, there was a bomb blast. During that bomb blast, our visionary president and his three friends saw a dream that healthcare industries is depriving of proper healthcare facilities in government and public sector specifically. And there was a lot of disadvantages of working in the public sector. So they saw a dream one day when they got some money or they got a chance, they will build, after getting the required qualification, they will build a free of cost hospital for the poor patients, where quality healthcare services will be provided free of cost. So Indus came into existence in 2007, where the quality journey started, because the vision was to please Allah subhanahu wa ta'ala and then provide the free quality healthcare services to the population of the Pakistan. With this mission and vision, Indus Hospital grow. Alhamdulillah, we have 10 hospitals across Pakistan. We have 4 regional blood centers, 38 PCP sites. And recently, with the growth of the time, we first acquired the regular license for Sindh Healthcare Commission in 2022. And then we proceed towards the ISO 15189 for the blood and blood center and the lab. And accordingly, the quality management system as well, which successfully and 2 reaccreditations has been conducted last year. And then in November 2023, Alhamdulillah, we were certified CAP accreditation, and we were the first hospital in SARC region of having a Association of Advancement of Blood and Biotherapies, AABB. In the SARC region, Indus is the first hospital till now. So this is
very good.
So by this way, actually the story, the little bit insight are similar to the Shaukat Khanam and the Khan, that we believe on the tracers and frontline worker involvement. So we are trying to involve the integration of our healthcare services and the quality services with the physician and the operational management as well. So this is how we are working, and this is how our journey started.
MashaAllah, very good. Thank you so much. And moving on to Tabba Heart Institute, Dr. Abir.
Yeah, thank you so much. Very grateful to be here, and congratulations to all of you for still being here and surviving the day. So I'm Dr. Abir Salim Habib. I work at Tabba Heart Institute as the Assistant Medical Director. The journey of Tabba Heart started a little more than 2 decades ago. It's a privately owned tertiary care cardiac hospital, which is not for profit. And a couple of examples have already been given. So we also have more than 70% of our patient on welfare funds. The journey of quality and patient safety, I would say, started with the vision of the philanthropist, Mr. Abdul Razak Tabba Sahab. His vision was to open a cardiac hospital where quality healthcare can be provided at affordable costs. Now, you can't have quality care without ethically justifiable care. So it runs hand in hand. Couple of things that were done initially, and this was all to the credit of Dr. Bashir Hanif. He's the executive medical director at Tabba Heart, and he was trained abroad, and he brought that vision of quality from the inception of the hospital. So the purpose-built infrastructure, the systems in place, electronic health records, everything related to patient engagement and empowerment was put in place at the very initiation. And our journey towards ISO, we have the QMS, the environmental, and just this year, we've gotten ourselves the occupational health and safety ISO as well. We also have the national and provincial regulatory licenses. And we are not only doing what is required nationally, but we are also connected with the more developed part of the world by sharing our data with complete transparency with the NCDR. And the American College of Cardiology has actually been awarding Tabba Heart Institute with their highest, most prestigious award, which is their Platinum Award, for the last couple of years, 5 years now.
MashaAllah.
So, and this was the first hospital in Pakistan to actually get associated with the NCDR. We are also the first one to be associated with the WHO for the Patient Safety Friendly Hospital Framework Initiative. So what has happened at Tabba is that we've internalized quality, we've internalized patient safety. And the next phase or the way forward is that we're not going to stop here. The idea is to develop a multidisciplinary care available at one stop for every cardiac patient. Thank you, Dr. Miraj.
Wonderful. Thank you, Abir. So, ladies and gentlemen, we have congratulations. We have completed the first round. आपको खुशी नहीं हुई? मैं तो समझ रहा हूँ इतने खुश होंगे बोलेंगे दूसरा भी जल्दी करो भाई छुट्टी करो हम जाएं. All right, we'll try to make it on time, and the second round will be an interesting one. And then I'll probably after the second round I'll come to the chairs and the co-chairs to sum up and conclude the conference. So we'll again start from you, sir. And this is a rapid fire round. And you know what a rapid fire round is? Bas, rapid fire karna 30 seconds. And the question is, tell our audience, our students, our faculty, any 3 tips, practical tips that you want to give to them if they want to implement safety in their primary care, secondary care, tertiary care. Your time starts now.
It is just related with education, training, capacity building, nothing else. Factually, the change in the attitude and culture. That's all.
Wow. Who's there?
So I think ownership is very important, leadership commitment, and working with the teams on the ground. So we cannot sit in our rooms and dictate to the teams. You have to sit with the staff, hold their hand, and that is when you start seeing the results.
I would like to add one thing. Intact or integrate your beliefs with your actions. Okay. So whatever you believe, it must shows in your actions. One thing. Secondly, engagement of people. Establish quality circles within the organization, like-minded people. And again, culture. Like Dr. Zaki said in his previous session, culture, that is very much important. Again, at this time, Yaqut National Hospital, we focus towards the cultural development, and we have regressive training sessions subject to reporting of near misses or incident without fear of repercussion. So these are the things which we need to focus. Thank you.
Very good. Shafiq.
Leading by example, not going for the low-hanging fruit, going for the most difficult ones. Identifying the goal, what is the end goal, where do you want to go, and of course a SMART goal would be fantastic. And third is explaining the why you're doing it.
Wonderful, wonderful. Dr. Asim Bilgami.
So I think it just gets more and more difficult as we
Yes.
move on, because most of the things are the same.
Yeah.
So again, I think education and training, because that becomes providing the tools for people to actually do what they need to do. Second is what people have said again before is establishing a culture of safety to ensure that not only is it non-punitive, but it's actually rewarded. And the third is leadership, that there really has to be a commitment from the leadership to move things ahead.
Excellent. Thank you, Dr. Asim. Dr. Haroon.
Yeah, so I think one needs to focus more on systems than individuals as far as training and development is concerned. If you develop systems, whoever comes in that system becomes a part of it. Otherwise, they can't survive in that system. Then the other thing is, always share your improvement success stories, because that's very motivating and encouraging for people, and learn from your errors. There's no problem in making an error as long as you learn from it. The problem is when you stop learning from errors and you try and blame individuals for errors.
Thank you, Dr. Haroon. Thank you.
Thank you. So for me is the vision, leadership, commitment, transparency, openness, and lead from the front and let the people reward for the good work they are doing. This is the basic part. Otherwise, other rest of the things are the same, what already been done.
Excellent. Wonderful. Thank you.
So along with what has already been said, trust your people, delegate the tasks, and do not micromanage.
MashaAllah. What a great experience it is to learn from these leaders. So such practical tips that they do day to day, and they are suggesting you, prescribing you. So we'll go through another round, and this time my humble request would be try to be as much candid as possible, right? Really what happened? Okay, we'll start from this side. No problem, we'll start from this side.
You're
Okay.
putting me in the spot.
So you're all leaders, and we would like to learn from you. As leaders, what keeps you awake at night from patient safety perspective? 1, 2, 3. What are the top 3 things that keep you up at night from patient safety perspective, from the real paradigm of what you experience? Go ahead.
So you treat people the way you wish to be treated. If a patient is not safe at your facility, then you will not be safe eventually somewhere. So that's the one thing I would say. The other is, again, trusting your teams. You trust them, you don't have to be awake at night. They will take care of things.
Okay.
Yeah. And number 3, I would say is, didn't give me time to think, actually. No, number 3 would be that whatever is being reported, the actions should be non-punitive. So patient safety would rise up.
All right. Just to facilitate you, give them applause. You can. Just to facilitate you, because we started from the left, that the game changed, and now I want to change it a little more. I'm becoming a part of them because I also manage 4 hospitals. I'll be very candid. What keeps me up at night? I run 4 secondary level care, predominantly women and children centers. What keeps me up at night? यार कोई CTG मिसइंटरप्रेट तो नहीं हो रहा होगा इसको? यार कोई माँ बच्चे को जन्म देते हुए अपनी आखिरी सांस तो नहीं ले रही होगी? यार कोई बच्चा फूल खिलने से पहले मुरझा गए. Believe me, मैं ये भी बातें जो कर रहा हूँ ना इस time पे, as I'm saying, as I'm speaking right now, I don't know how many mothers, how many women, how many children are taking their last breaths right now, not only in Pakistan, all across the world. Those are the things that keep me up at night, believe me. And we do the best we can, we do huddles, we do RCAs, we do the best we can to learn what we missed, what needs to be done differently. And that is what will differentiate you from others. Is tip ke saath, Dr. Lubna.
Thank you very much. Being as a quality lead at Indus Hospital, the things which keep me awake during the night is if I know that there is a lot of turnover nowadays with the nursing and the doctors, everybody is draining, brain drain is draining from the Pakistan. So what about there is unsupervised doctors, the new doctors, because of the lack of the supervision? What if the nurses are not supervised and they can do a harm? What if there is my training is lacking and they can cause a preventable harm which we can prevent, and it could happen anywhere. And Pakistan, we are on the topmost class. So these are the few things which make me awake. And the important thing is lack of the just culture. If somebody is doing mistake and not accepting and not reporting, this always make me awake at the night. Incident reporting, so that this is the one of the parameters by which we can improve. We can improve a lot in our services. So we should have to give liberty to the frontliners. Okay. Thank you. Okay.
Thank you.
Yes, so apart from my prostate, what keeps me awake at night is, you see, we actually get money as donation from people. And from a religious perspective, we are custodians of zakat. And what keeps me awake at night is some of our processes or systems. I hope they are not too extravagant and we are not misusing the funds in terms of trying to achieve a certain degree of quality. And the other thing that keeps one awake is that the people who come to us for their care have no one to turn to. So it is, when you're dealing with private patients, you're dealing with your peers and your equals who have those contacts and the resources to take you to task if something bad happens. These people have no one but Allah to turn to. So I actually get very scared in my clinical practice as well as my quality assurance practice that if harm comes to them, they only have Allah to turn to, and nothing can save us from Allah if we've done something wrong there.
Thank you, Dr. Harun. Dr. Hassan.
So, in addition to what's all been said, that's all keeps all of us awake, really. What I worry most about is things that I can't have control on, things that are outside the control of the institutions itself, quality of medications, quality of equipment, that kind of stuff. That a lot of things that we should be reliant on the government, for example, for ensuring, but we know that that system does not work all the time. And for example, quality of chemotherapeutic agents. That's a big issue across the world right now. And there have been multiple issues relating to that across in Brazil and in India and other places as well. And it's those kind of things that really worry me more. Things that we are doing in our own hospital or in our own institutions, and I'll speak on behalf of all of us, is that we know how good that is or how bad that is. But it's those things that we cannot control that worry me.
Thank you, Dr. Hassan. Shabash. Shafiq?
Thank you. I was struggling to come up with all three, but I think I have. So the first thing that I worry about is complacency. What if the team thinks we're so good and it's all great? So complacency is what makes me worried. The second is something very strange. It's the fear of making mistakes. And what if everyone is so afraid of making a mistake that it ends up in paralysis and not doing stuff which in many ways might be required? And the third is a very personal reason. I was on the way to pursue a clinical career myself, and then I adopted a different path. One of the reasons for that was I felt I couldn't take the responsibility of individual lives if I was treating them, and what if something went wrong, only to now be responsible for 2,500 people who are busy treating others, which is such a massive responsibility, because here it's all about the system and the culture you put in place.
Yeah. Wonderful. Thank you.
I think loads of things said. I just to add one or two things here. The thing which scares me the most is the loss of life, any individual life. I've been to different industries and I came across such kind of comments that safety is so expensive, quality is so expensive. And as far as auditors is concerned, okay, if you think safety is expensive, then try an accident. Then you can see. It's not about somebody lost a father, a brother. It's all about the family. So that scares me the most. The second thing, when people think they are 100% perfect, there's no room for improvement. Okay. What my belief is, and what our belief is, except Almighty God, Allah subhanahu wa ta'ala, nobody is 100% perfect. That scares me a lot.
Wonderful, wonderful. Thank you.
So, Dr. Miraj, as leaders, we have a lot of responsibility. And one of the things that actually keeps me awake at night is that you cannot ignore a single thing when you're working in a hospital, because every minute thing, very small thing, can lead to a patient safety event. So, for example, if working in HR, sometimes it's a procurement thing, that's not my headache. Sometimes it's a finance thing, that's not my headache. But as leader, every single thing is your headache. So that is a big responsibility and on our shoulders, and that definitely keeps me at the night. Thank you.
Thank you, Zair. Thank you.
Thank you very much, sir. Sir, talking about 3 points, I'm honestly very much concerned about the affordability of the patients. This is a very serious concern. Reason being, healthcare is very costly, even charity organization, because people can't afford. The other thing, which is for me, I'm accountable and I'm answerable, and especially my faith drives me on one side as a social responsibility. I'm accountable to myself, my family, my society, but above all, I'm answerable to Almighty Allah. And every event which is going on, it has been recorded and it will be available at the day of judgment. So that's the major most concern for me.
Wonderful. Thank you. Thank you. This round also went pretty well. And now the last and the final round. And this would be a focused one. And we'll ask a few of you to respond quickly. And I'm sure the students and the audience would be very much interested in knowing how each one of you have implemented or monitoring the 6 international patient safety goals in your hospital. Are you all aware of 6 international patient safety goals? How many? हाथ उठाइए जी बताइए कौन कौन से गोल हैं? All right, so moving on. So I'm glad there's so many hand raises. The first goal is to identify patients correctly. Okay, let's hear from Uzair. Evercare में आप कैसे इंश्योर करते हैं कि पेशेंट्स को करेक्ट आइडेंटिफिकेशन हो?
So, Dr. Miraj, it was a challenge to start with because एक तो नाम बहुत ज़्यादा similar होते हैं and people are used to क्या कहते हैं MR numbers भी बड़े different तरह से formatting हुई हुई है, standardization इतनी थी नहीं. So when we started, what we did is that when we developed our own system, we keep this information as mandatory in the system. So patient identification with name and MR is mandatory. So this information is so important that even our security guard knows that what are the 2 patient identifiers. It immediately say name and MR number. So नीचे से we started and then वो आहिस्ता आहिस्ता gradually ऊपर आने लगा. अगर मैं एक और IPSC की बात करूं जैसे fall risk है, again very important IPSC goal. So ये भी हमने system के अंदर built in किया. So बहुत सारी ऐसी चीजें थी जो हमने mandatory की ताकि लोगों को पता चले कि how important that is. क्योंकि आप अगर कल्चर डेवलप करना चाह रहे हो तो कुछ आपको स्ट्रिक्ट एक्शंस भी लेने पड़ते हैं, कुछ मैंडेटरी चीजें भी करनी पड़ती हैं. सो दैट इज हाउ वी टुक दिस चेंज.
A big hand for Evercare Hospital. The goal number, international patient safety goal number, relates to effective communication. And one important element of communication is communication of critical lab results. शफीक, आप शेयर करेंगे कि RMI में आपने कैसे, how you take care of reporting of critical lab results?
I think starting a process, even if it's on pen and paper, is so much more important rather than going and jumping digital. I think the process there in that pen and paper, picking up that phone call and recording and documenting it, has been there for a while. And so since a few years now, more than a few years, it's been automated, and now there's all those digital tools available to ensure the same is done more effectively.
Wonderful. Dr. Asim, can you share with the audience about the goal number 3 or goal number 4, safe surgery? I mean, how do you ensure at your hospital that everybody is using the surgical list, doing the timeout. What is, in practice, what is being done at AKUH?
Again, this requires teamwork, and it requires empowerment of everybody. Surgeons, we know, and I don't know if there are surgeons in here, but with due apologies, surgeons are not terribly good at it. And it so becomes the responsibility of everyone around them to ensure that the mechanisms that are in place for, for timeout and sign out and identification and all of that is implemented. And again, it's a continuous process, and that needs to come with continuous encouragement of all the team members to speak up and speak out and ensure that that all the processes in place for safe surgery are being implemented.
Wonderful. Thank you, Dr. Asim. And let's learn from Shaukat Khanam. How do you ensure the compliance to the goal of reducing the healthcare or hospital-acquired infections?
So rather than just focusing on one IPSG, I'll just make a collective statement.
Sure.
Our philosophy on this always has been is to first read what is required, and then looking at our own working or current SOPs, how much of that is met and how much extra needs to be done is to do that gap analysis, produce that extra, keeping the stakeholders in hand, because there's no point of developing policies in closed rooms. Then nobody's going to have that ownership. Once you've done all of that, the next step is ensuring that all the resources and time are available to be able to carry these functions out. And then trying to reduce, I'm going to mention human factors because there's been so much talk of human factors. We've brought that into our system in play in a lot of things that we do, that you cannot proceed with a patient in OR unless a timeout has been signed online. You cannot proceed with billing for a catheter unless a pre-procedure note, including a sign-in and a pre-timeout sort of has been signed. So you develop a policy, you do the training, you keep the stakeholders on mind, and then you develop a monitoring system. But most importantly, you ensure you provide the adequate resources in terms of, especially where possible in today's day and age, with your EMR, so that everything becomes integrated in the patient journey and nobody's doing anything extra and what you want gets done.
Excellent. Can I ask you one more question?
Yeah.
Either you or Asim both can answer. Say people are not following the protocol. This morning we were talking about human factors. People are not following the hand hygiene. You are giving education, training, audits, scores, stubborn. What do you do? What is your corrective action?
I'll say what I said in the morning as well.
No, you tell us what exactly you do.
So you see, every time an error happens, I will repeat myself on this, that no doctor or nurse comes to the hospital wanting to do errors. They come into the hospital trying to do good. If an error happens, the first question that you should ask yourself is there anything wrong in my system or policy which led to this error? You first need to focus on that. If you are sure that there was nothing there, then you need to consider if that human factor or error happened, was there because there was staff fatigue? Was it because staff was being asked to do jobs that were beyond their training and capacity? Once you've addressed all those factors, then you come to individual blame. So a just culture has to be maintained. I am all for it, and I'm all for punitive actions where they are deemed. So if a surgeon refuses to do hand hygiene again and again and again, despite there being an appropriate number of people on his list and everything being made available to him, then yes, you have to take him to task. But at the same time, before you come to that conclusion, you have to make sure every T has been crossed and every I has been dotted to make sure that the right resources were in place for him to do or carry out the task the way you wanted it to be done.
Thank you so much. I mean, the universal approach, quality doesn't believe in punishment or punitive approach, but it doesn't mean people interpret this in a very wrong way. People think, oh, quality doesn't believe in punitive way. Oh my God, if someone is killing someone, I'm just giving you an example. Oh, you say, well done, you have killed someone, right? Non-punitive approach. No. There is a spectrum, and at each part of the spectrum, you have to then, I know you have to sometimes suspend the privileges of physicians and surgeons. Suspend the clinical privileges of physicians and surgeons if they don't do or abide by the medical staff bylaws. So I didn't push that to Asim, but behalf of Asim, I responded it. CMO को देना चाहिए था जवाब, CEO ने दे दिया. Last response we'll seek from Lubna and Abir. The last patient safety goal will break in two components. One is, tell us your practice so that we can learn from you and we can implement those practices. How do you prevent falls in your network hospitals?
Okay, there are two strategies we are devising. Number one is for the pediatric patient and adult patient. From the very beginning, while we are under construction, where new building is being constructed. So from the previous experience, we are moving towards the equipment or procurement of the tiles, the infrastructure. This is the one strategy. Number two, the beds we are acquiring or procuring. So for the pediatric patients, we just started a program for the fall prevention by stripping a single layer. You know, there is a gap between the handle which we are using for the restraining of the patient. So we are putting a very fine like a mesh like thin wire so that the fall can be prevented. So these are for the pediatric fall, and same goes to the adult fall as well. Plus, there are certain points we are using, like the fall band attachment, patient's assessment of the CNS status before moving individually or independently towards the washroom, assistance for the nursing side and the attendant as well. Since we are a cashless hospital, so we are always having a constraint of the human resources. So we are training, providing awareness session to the attendants as well, in order to prevent fall for the adult and pediatric as well.
Thank you so much. So Abir, last goal, I switched from fall. We all know the safety of high alert medication, how big challenge it is, especially concentrated electrolytes and other medications. So Abir, can you share what Tabahart is doing to prevent errors from, especially for high alert medications?
Thank you so very much for this question, Dr. Miraj. So Tabahart is very highly focused and prioritizes safe medication practices. And for this very project of high alert medication, what we did was we removed all kinds of electrolytes from the floors, and now they're dispensed per order. In fact, Tabahart received the ISMP Chairs Award, which is a US-based international award, and became the first hospital in Pakistan to receive this honor based on a project of ensuring medication safety, because we're a cardiac care institution. Every patient is high risk, and a lot of medications are high alert medications. We have all sorts of tagging and flagging in place. Every time a high alert medication is ordered, the electronic system would also raise an alert that, okay, is this the medication you wanted to order? And in case of wrong dosage, in case of wrong route, or anything else that's a prescribing error, the system again gives us an alert. We have clinical pharmacists who are placed on hospital locations and intervene timely. And the physician has to actually respond to the intervention, whether they accept the intervention or call up the pharmacist and tell them the rationale for issuing a certain dose of that particular drug. We also have a very strong incident reporting mechanism in place, so we know exactly how many pharmacy interventions were done at prescription errors or errors that were related around medications. We have a very strong system of outpatient pharmacy counseling, where every prescription before the medication is handed over to the patient, there's a counseling between a pharmacist and the patient. And we also have a helpline, so the patient can call us up at any point in time and get all their queries answered.
Thank you so much. You know what she said? I think all of you here heard that. You said you were the first hospital in Pakistan to get ISMP on safe medications? लोगों ने सुना नहीं. Yeah, कम से कम ताली तो बजा देते हैं. First hospital in Pakistan getting an award here on something which is so important. My goodness, yeah, I really enjoyed it, yeah, this session, moderating it. I don't know whether as panelists you enjoyed it or not, or whether as audience you enjoyed it or not. Did you? नहीं, ऐसे तो पता नहीं चल रहा. यार इतनी मेहनत की है, कुछ थोड़ा ज़्यादा deserve करते हैं ये. Please, everybody. Yeah, that. Now I'll hand over to the chair and the co-chair, Leslie and Asadullah Saab, if you can final conclusion and remarks and conclude the session.
Bismillahirrahmanirrahim. First of all, though, before I go to the panelists and their wisdom, I would like to thank and congratulate Dr. Mehraj, de facto moderator of all future conferences of ICPS. Bhai, you have made it so high, so now it will be gonna be tough for anybody else. Jazakallah khair. Handling 8 top-notch hospitals and their leaders and their experience in 1 hour, you have been able to, share, help us share with you all of their experiences. I think we could, amass up to thousands of years of experience. These hospitals with all their physicians and doctors and nurses. Mashallah. Thank you, Dr. Mehraj, and thank you all the panelists. The pearls of wisdom and the depth of personal insights and the experiences of all these hospitals has been such profound that when I was trying to write and summarize at the end, I will not be able to do it. So I focused myself on just one thing, which is collaboration. I believe that what have come out very strongly for me is that there is so much out there, and we need to work with each other, and collaborate with each other, and learn from each other to be able to develop a healthcare system in Pakistan for all of the Pakistanis, right from this beautiful city of Islamabad to the small town of Turbat at the south end of Pakistan, in Balochistan, very far-flung areas. So we need to do a few things, and that's the only thing that I can focus on right now is collaboration. And collaborating, first thing would be development of team of really high-class healthcare professionals, as Aga Khan has been able to do it, Shaukat Khan has been able to do it, Tabba and RMI and Liaqat Medical and Al Khidmat, and new entrants like Evercare, which have made a great impact. So development of healthcare professionals, and we cannot do it individually. We have to work with universities, we have to work with each other, and we have to work with the government to develop standards and curricula, also undergraduate and postgraduate curricula, embedding these experiences into them, ensuring that our students are not given theoretical. I'm not talking about just medical and dental, which has a strong, very clerkship, but also all the other programs, how these programs can be run in the hospitals, and make use of the experiences that we have in the hospitals. Second is, we all make mistakes, and to err is human. So don't be afraid of making mistakes without being reckless. We can't be reckless, but we have to be able to have the courage to experiment, to make mistakes, and to learn from them. But the key is that we do it in a structured manner. Not make structured mistakes, experiment structurally. Okay, so we need to develop these pilot projects, conduct operational research, but also publish them, share with others. And once we all start sharing, we all learn from the others, and we learn from what mistakes Shafiq, you have been making, that, and what you will learn from what our mistake. Because that's only we will be able to learn and develop in our own context. Of course, we will learn from Leslie and Murad and all the international experiences that all you have. But we have to learn what in the context of Pakistan, what works and what does not. So we have to do that as well. Also, we can do one of the things is we need to have these platforms. This platform of this conference is one of the platforms where we learn and collaborate. But this is probably once a year. We need to do it more often. And I would like to remind all of us that in a previous conference like such, we vowed and we established healthcare and safety and organization of Pakistan, HQSAP. HQSAP is still one of the sponsors of this conference, and we established it. But unfortunately, we have not been able to make that platform as active and as workable as it should be, and what actually value it has. So I think one of the key outcomes that I what I will have. And I'll request my colleagues and all the healthcare professional here to become members of HQSAB and start using that platform to build agenda for change at the national level, but also at the local level, and share with each other our experiences and learn from each other. So collaboration, collaboration, and collaboration. I think that's my.
Thank you very much. As Leslie Thompson from Accreditation Canada, I am so honored to be part of your panel today and to reflect on a few things. Earlier this morning, I captured 5 C's that I thought would be relevant as you consider your own journey. I've added 2 based on what I've learned today and at this panel. From all the things that I've heard today, my reflections and encouragement for you are thinking about what all of you are demonstrating. First is that clarity of purpose. Each of you talked about the why and the people-centered, the patient-centered, the mission, the connection to your core purpose. Quality without being connected to the core purpose is an empty series of tasks. So that is number 1, and I've heard that from all of you. Number 2 is the importance of adapting to your local context. And that applies to each of you in your own hospitals and health systems, as well as to the overall in terms of your local communities. But as you adapt to your local context, do not reinvent the wheel. You need to build on each other, be learning health systems that really help you move forward with more speed and confidence and consistency. The third C is keeping a comprehensive view of health and quality. While we hear from each of you as your individual organizations, be you a hospital, you are one part of an overall system, and you need all of the parts: primary care, home care, long-term care, community care, working together to influence the health and well-being of the populations you serve. So keep that comprehensive approach. Think of how you connect with each other in order to create an overall robust system for Pakistan. The fourth C is capacity building. And I heard from all of you the importance of that, building skills and capabilities. That starts from the way in which you prepare healthcare professionals, starts right from the curriculums, and making those fit for purpose for as people enter the workforce, want to stay in the workforce, and are continue to be supported in the roles that they have. So that capacity building is a big piece of the work of leaders. And with that leadership, your role, and all of you have talked about the importance and the various ways in which you are building culture, and cultures of quality, cultures of people-centered care. And that culture is about inspiring change and inspiring the right things to do, not just the inspections of lists and KPIs and reports. It is about the inspiration for quality that will make the difference to with those people that you work with. And that bringing transparency builds that culture of trust, which also I heard from all of you as being very key. The other is the notion of quality as a continuous journey. And all of you spoke of that. And I want to congratulate you on all the great examples of where you've been building and the momentum, and keep it going, because this is a continuous journey, and it takes all the collaboration across all of you and with your many other partners to make that happen. And finally, I would leave you with the notion of continue with courage. And you mentioned that yourself. Sometimes the overall picture can seem so very daunting. And it's so hard to think, how can I make that little bit of difference? But that courage to carry on, that courage to tackle the bold challenges of improving the health and well-being of the population of everyone in Pakistan. I think that is what I wish for you. And you've inspired the courage in me as a partner from Canada. Think of us, think of other partners to join you in this journey, because together we really can make a difference. And I thank you so much for your leadership and the great work that you are doing here and the opportunity to share in that journey with you. So thank you.
Thank you, Leslie. That was a great, outstanding summary, and the way you have expressed it in the forms of 6 or 7 goals or priorities, that really reflects the true spirit of what these great champions of quality and safety have discussed in these questions. Ladies and gentlemen, once again, join me and give a warm applause for all the panelists, the chair and the co-chair of this session. Thank you so much for your patience listening. You are a lovely audience, believe me, and you are all champions of quality and patient safety. और बच्चों जो आप लोग सारे आधे रह गए हो, बल्कि पाव रह गए हो, कल को आपने ये रोल लेना है. So please, come forward and promote quality and patient safety. We look forward to see you as the healthcare quality and patient safety champions of tomorrow. So wish you all the best. With this, we conclude this session. Thank you very much. I don't request, I no request.
Yeah, no conclusion. Sorry. So thank you very much. So in the next 5 to 8 minutes, so Asabek, we'll just conclude like this, right? Because you already said what you wanted to say, right? And so just a little background. So this particular session has been the oldest session of Patient Safety Conference, ICPS. And ever since we started, we had this session. Why, what, and how. And I've been moderating this in the last 6 years. But what Mehraj has done today, so I really, actually, I was feeling that, I should have done it. But you have really done a wonderful job. So really, I want to congratulate him. And you will appreciate, the value and the strategy behind this session. Because I'm sure that people out there, or maybe people sitting here as well, I'm sure they are encouraged, they are inspired, they are motivated, and they are more educated by learning from the other institute. Maybe there is a healthy competition as well. But I remember, Asim, if you remember, the one before in Karachi at Liaquat National Hospital. Alhamdulillah, we had around perhaps 11, 12 medical directors, and even then we wished that we could have more of these conversations in a formal way. But then again, we go back to our day jobs or main jobs, if I may. You are a pediatric oncologist, and other than Mehraj, everyone does something different. So Mehraj or Lubna, right? Or maybe no, Hamad. I'm sorry. So that's where we are. But this is the most permanent session. Maybe we can redesign it for the next and make it more integrated and have more inclusive with other hospitals. I'm sure there are other hospitals which would have loved to share their journey as well with us. So a few announcements. So just to remind you that we had a free paper and abstract session and a competition, and Abir moderated that. Yeah. And we knew that session is safe in our hands. And that session is actually, the awards are sponsored by Health Research Advisory Board. It's an independent organization which focuses on developing the research ecosystem of Pakistan. I'm very much involved in that as a general secretary.
And we give these awards in pretty much every specialty area to promote health research in that specific specialty area. So how could we ignore patient safety? So for the last 4 years, Health Research Advisory, 3 years, Health Research Advisory Board has been giving out these awards. Actually, 5 years, but we have renamed it. And we renamed it in the name of Professor Dr. Tahir Shamsi. He was the pioneer of, bone marrow transplant, a visionary, a researcher, a clinician, but above all, he was an exceptional human being and a brother to me on a personal level. So we have named, and he passed away 2 years ago. So we renamed this award in his name, Professor Dr. Tahir Shamsi Research Award in Patient Safety and Quality. So today we had Saima 70 plus 90. So I can tell you that we have never received 90 submissions ever in our history. Last year, Saima, kitni hongi? 30, 40, right? So we have actually doubled this year, Alhamdulillah. So that shows, the impact of conferences and activities like this. So we had around 90 plus submissions, and obviously Dr. Saima and Dr. Siwal and the team had a very daunting task to come up with the first three in two areas. One is oral presentation and the other is poster presentation. So I'm just going to announce the name, and if you are in the audience, just stand up, please, in the interest of time. So first we'll go with oral presentation, and the third position is Ms. Sheba Saqib from Shaukat Khanam Memorial Hospital from the Quality and Patient Safety Department. Just stand. Are you Sheba? Okay, good. Yeah, you recognize it. Congratulations. The second position is Anosha Jabin from Shaukat Khanam. Okay, any specific reason for both awards going to Shaukat Khanam? Siwal? Okay. Yeah. But when you hear the first one, you'll say, yeah, definitely there's something going on. So the first is Dr. Shumaila Barni, Rifa University. So we are obviously going to give them cash awards. And please, thank you very much. And congratulations to all three of you. The second is the poster competition. Again, third, second, and first. So I'll start with third. So Wajiha Ali, she's a medical student of Rifa International University. Poster competition. I have the details, but again, in the interest of time, I'm not going there. Second position, Bushra Batul Zehra, MPhil student, Rifa International University. And again, I think two organizations are just playing with each other. Jawad Ahmed, Shaukat Khanam Hospital, for the first position for the poster competition. So congratulations to all 6 of you. You will be hearing back from Health Research Advisory Board, and inshallah you will receive the cash awards. So congratulations, and I request all of you to especially pray for Dr. Tahir Shamsi as well. So we are actually moving to the conclusion. Asadullah Khan Saab mentioned about HQ SAP, Healthcare Quality Safety Association of Pakistan, and this is a vision which RIFA developed along with a few visionaries, including Dr. Bari Khan and Dr. Bashir Hanif, and there was a few, and we had shared with Asim and a few others as well. But in all fairness, we have been struggling to really, even if we cannot make it a formal association or society, but at least a forum where we interact and we talk to each other more, other than just meeting each other once a year. This is not good. Although we love to, do that every year. So, again, we will, go back to the drawing board, and we'll, Miraj, we need your, help and support in that. And each one of you sitting here, and some others who are not here, to contribute and, try to make it active. But the other thing which we can do, and I'm announcing it today, is that uh, we are going to launch an online platform of collaboration for all healthcare professionals and leaders from Pakistan. So this will be a place where you can not only connect, collaborate, network, learn, share, chat, socialize, share your research as well. So we are going to, inshallah, launch this online platform. And why I'm saying that, because we've already launched that platform in the research space. So it's just that we need to customize it with the help of Rifa University, because we'll need some money. So I will ask Asadullah Khan to announce it, as we ask ministers of health before they leave, announce, just say something. But I think that will make a difference, because this is the age of technology and we are all connected anyways. So this platform, inshallah, will be able to connect those who are unable to join us in person as well. So with that, I would like to thank the organizers, the team. I'm part of the organizers, the team, especially Mustabshira, who's sitting here. Unfortunately, you cannot see her face, you cannot see her smile and, cry. Yeah, relief. But she's the single most person. If you can stand up, please. Mustabshira has been. So I work a lot. I know that we have sleepless night, but I cannot even match what she has done. So thank you very much, Mustabshira. Uh, Without you, we could not have done it. The coordination, around 80 national speakers, it's very complex. So thank you very much, Maqsood Saab and his team, RIFA team, RHS team. There are a lot of people sitting here. मैं उनका नाम चूंकि आप सामने बैठे हैं तो नजर आ गए, लेकिन there are others as well. So thank you for the whole team who contributed. To our international speakers, our old friend Siwal, Rabab, you have been inviting me regularly to your conference in Jordan, and I love that. So, we just thought that you should see what we do in Pakistan. Leslie, initially, Leslie had, uh, she had regretted because she had exceptional traveling plan, but I just kept, I never give up. I never give up, Alhamdulillah. And the last time I knew it's a long shot, I just said, okay, is there any change? And she said, actually, yes, I may be able to pull it off. So we are so happy that you're here. And I am sure that this will start not only relationships with all of us here, but a new chapter for you, for Pakistan and Accreditation Canada. Dr. Shahid, I'm sure you have received a couple of invitations already. Yeah? Yeah, I know that. But we invited him very specifically about human factors, perhaps is one of the most important missing link. So Murat, who had to leave early morning, and Alhamdulillah, we have broken that myth that JCI cannot come to Pakistan, because they haven't in the last maybe 12, 13, 14 years. I don't even remember. But Alhamdulillah, and because of a few people who could not come, but those were the unsung heroes. So so Murat, Siwal, Shahid, Leslie, and Rabab, and anyone else? Ji? Yeah, Zina. Zina. Yeah. I don't see her, so because she has left. Yeah, Zina. So, thank you very much from the bottom of our hearts, sincere. Yeah. So, yeah. So, if I don't, thank the media team, they'll turn off the mics. So, the media, Max team, everyone. So, there are a lot of people to thank. My panelists, around 80 plus national speakers, some are sitting there. This has been a brilliant panel. And I have actually learned and I've been inspired, with brilliant stories, huge networks, and opportunities of collaboration and learning. Al Khidmat can learn from Aga Khan can learn from Al Khidmat. Visionaries, I consider Shafiq as one of the healthcare visionaries in Pakistan, and I think that he should play a bigger role He has the potential Allah subhanahu wa ta'ala has given him, and I will keep nagging him with that. The brilliant audience, you've been very supportive. Without you, we cannot have a conference. Anyone else I've missed? Mustafa, Dr. Saima, who tried her level best to not actively participate, but we did pull her, and you saw her last night at the dinner. तो इन्होंने मना तो कर दिया था, लेकिन एक patient safety champion awards are winners of the patient safety champion awards this year. We always give 5 awards. So with that, and a big thanks to me, as Leslie is saying, it's my privilege. It's my privilege I believe in institutionalizing things. And when Asadullah Khan and I and Hassan Khan, the Chancellor of Rifa University, we were having breakfast in Turkey, we were having this discussion, and that's where this institute and conference actually came into existence. We all agreed that we have to move out from being individual champions or experts, and we need to develop organizations, institutes in Pakistan. And Alhamdulillah, that's what we have been able to do, so that others can follow, and we can slowly and gradually we can build and reach a place and cross the quality chasm. Hopefully, we're not there yet, but inshallah, together we can do that. So please work with us, work with each other, collaborate. As we say in 7 Habits, we are all interdependent. So with that, we close this conference, and inshallah next year, hopefully we'll be doing it in my city, which is Karachi. And I was discussing with Miraj, Aga Khan University actually hosted our conference, and that was actually a major, what would I say, change and initiative, and a symbolic thing for us. It was great. So maybe next year again, Liaquat National and Aga Khan and Indus and all of you can co-host, Tabba can co-host the Karachi conference, inshallah. Thank you very much. Until next year. Assalamu alaikum wa rahmatullah.